Hello, everybody. My name is Scott Valentine. I am in the 2 p.m. lecture class for bio, and this is my video for the COVID-19 positivity rate data. So I did my regions over Minnehaha County and Pennington County. So if we can look at the population size, Minnehaha County has 134 in the population as of 2019. And then Pennington County has 113,775 in their population as of 2019. This is obviously from last year's because I cannot find current year's population size. I don't know if they just update at the end of the year or something else, but that's what Google is telling me now. So, obviously, Minnehaha has 79,359 more people in its population than Pennington County. So obviously, it's gonna influence the data set that I did for from August 21st to October 7th. So let me switch screens a little quick. So as you can see, on the left side is Pennington County and Minnehaha County with the outliers in the data set, while the one on the right graph has doesn't have the outliers in it, meaning anything with 100% or more, or not, or over 100% or less than 0%. So this one's for August 21st through the 20th of September, and then this graph following is from September 21st to October 7th. So we can see there was a couple major spikes with 180% on the 26th and then 106% on the 29th in Pennington County. Now this isn't really a high percentage, but for the second half it's the highest percentage, which is 46.5% on the second for Minnehaha County. I didn't want to put those two together because it kind of meshes it up as I did for the positive tests, so I can't really tell which is what it would do, but I could probably set that up. So with the outliers, it's hard to tell what exactly it's doing. So without those outliers, then we have these two graphs. So as you can see, still Minnehaha County has less positivity rate than Pennington County still within over that period of time. So the highest one now should be, oops, I did not mean to do that. Should be 84% instead of that over 100%, so it doesn't really mess with the graph. And you can obviously tell there's more variation between the data points than when you look over here, when you can't really tell what's really going on in between. So it kind of just zooms the picture in a little bit more. So from my understanding, with this being the way it is, I believe that Minnehaha had more regulations than Pennington County, and so they had less positivity rates, less less higher positivity rates. Sorry about that. Than Pennington County, except for this one time on the 2nd with 46, and I believe on the 2nd, if I go over there, where do I go? There it is. Oh, it's October, my bad. 80 positive cases or 172. So that does put a damper on the data set. So if we go back to, or go to the article about if we're meeting our testing target in South Dakota, we can see that there it goes. We can see that South Dakota isn't meeting its target. The only states are New York, Massachusetts, Connecticut, Rhode Island, Vermont, New Hampshire, Maine, and Washington, D.C. met their targets. And then California, Washington, Michigan, West Virginia, Maryland, and New Jersey are almost to it, while the rest of everybody, so the rest of the 36 states, oh, I guess Hawaii is one of the one that met their target. I did not see it. The rest of the 36 states didn't. They're probably still struggling with it. They probably don't have regulations, or not everybody's testing, or some, like half of the population of the states aren't wearing masks. So if we go down here to current testing measures, South Dakota is number 1 on the positive test rate, 39%. Our percentage of testing targets is at 8. We're doing a daily test of 225 cases. So that's a lot to cover in South Dakota. And it looks like there's a trend of 37 being hospitalized per 100,000 people. So our target should be 100%, I believe. But we're at 8% of the state not testing. Or not. I think not testing? No, it should be testing. So it's bad. And then one before that is, second runner-up is Iowa with 11 at 23% for positive test rate. And the overall United States is at 6%, 56, daily test of 331, and then 12 per 100,000 being hospitalized. So I think we could be doing a better job of getting tests done, making sure we're staying home, and if we feel not great to go to work or school or whatever we're doing, if we're not feeling great, I think we should stay home. As the public view, I would want to say that they should be seeing that what measures we're doing right now isn't really helping, especially in South Dakota, is with no regulations, that we should have regulations, that we should wear masks, that we should be social distancing. If we're not feeling great, then we shouldn't be going to work or school, even if it's like a mild symptom. Even still, it could be possibly COVID, and we don't know because of all the symptoms that they say that we have. As a healthcare would see it, they need to be doing more testing in every state. especially in the 36 states that are not even meeting their testing target. Because as we can see here in Hawaii, Rhode Island, Connecticut, Massachusetts, New Hampshire, New York, Washington, D.C., Vermont, Maine, they are all meeting their testing targets. And that's probably because they're all getting tested when they should be. As a government officials or just the government in general, they should be introducing more regulations for the entire country. And that can be either regulated by state or it just being an overall federal, like a federal law that you have to be abiding by the laws. And then we probably can lower our positivity test rate and get more negatives than for the total average. So that's just my opinion. And I hope you all enjoyed what I did. So thank you. Have a good one.